Hi everyone. Today I'll be just telling you about the International Ovarian Tumor Analysis criteria. This is basically not something very new. It's an old thing, but many times in the class, you people have asked me that what is IOTA criteria. So I just thought I'll take this topic up for you all. Now remember one thing, that you don't need to apply this criteria all the time. There are certain conditions when we get a little confused whether this mass is malignant or this is benign. No, there are no typical features as such. Then in those cases you can make use of this, and especially if you are new, with experience gradually you will come to know that what is this ovarian mass. But when you are new, you will often get confused that what kind of a mass is this? Is it malignant, or is it benign? What should I write? So in those cases, this criteria can help you. And what is this criteria basically? Now they've described 5 benign features and 5 malignant features. So for the benign, they have said that they've just named it as rule B1, B2, B3. It's not like something staging or classification, but just the name is there. So the first benign feature, they said it is unilocular cyst. The second one, solid components are there. So this is a unilocular cyst, no? Single cystic. And see, now if I just look at it, I know by my own experience only and by what I have learned before that this is just an anechoic simple cyst. So obviously this is benign. But let us go to other things. So this is B1, unilocular cyst. Then the second feature, they said that there is a solid component in the cyst, but it is less than 7 millimeter. There may be multiple also, but they are less than 7 millimeter in size. Then the third point, they said that there is presence of an acoustic shadow. Now very often we say that if an acoustic shadow is present, then it is more likely a benign mass. And especially what we consider, what do we think of it when there is an acoustic shadow? We know there is a calcification, so we think on the lines of dermoid. Then the fourth one, they said that it's a multiloculated mass. It may be a multiloculated mass. So this is the fourth benign feature, multiloculated mass, but it is usually smooth outlined. It is not irregular, and the mass is not very big. It is less than 10 centimeter in size. Then the fifth point was, sorry, this has been labeled wrongly, it's B5. Fifth point was obviously related to Doppler, and that was that the vascularity was minimal, or hardly there. I should say they say no vascularity, almost avascular. Even if we are seeing vascularity here, it's only at the periphery, not related to the mass or inside the mass. So we had 5 features for benign. Now similarly we had 5 features for malignant. The first one, M1, irregular solid tumor. So it was irregular and solid. Second one, it said that it was ascites was present. That was another point that could go in favor of malignancy. Third one, there are papillary excrescences. What do we mean by papillary excrescences? That's these irregular protrusions that you are seeing here. Papillary excrescences, and not only there were papillary excrescences, but there were at least 4 of them, right? So if I see 1 or 2, that may not be considered malignant feature. Then the fourth point was that it said that the mass was irregular, multilocular, and the size was more than 10 centimeter, like you see here. No, this is an irregular mass. It is a multiloculated mass. In addition, it is having solid components also. And if you can see, the measurement was coming around 14 into 11 centimeters. So it was a huge, big mass. And then the fifth feature for malignancy, they said that obviously increased vascularity, particularly, we all know, particularly in the solid components inside the mass, in the central areas of the mass. So I just repeat the features that were favoring benign: unilocular cyst, solid components present but less than 7 millimeter in size, acoustic shadow is present, multiloculated, well-defined, smooth-margined mass which was less than 10 centimeter, and then there was hardly any vascularity, avascular masses. Then the features favoring malignancy: solid, irregular tumors, then a presence of ascites, presence of papillary excrescences, at least 4 of them, and irregular multiloculated mass which was having a size more than 10 centimeter, and then increased vascularity. You can say high, you can say moderate also. So any kind of vascularity, especially in the central area, I would say that it is, you have to be careful about malignancy. Now we come to how do we interpret it said that if we have one or more malignant M features or malignant features present and no benign features present, we would label it as malignant mass. If there was one or more B features present and no M features present, it was benign. So just one feature was enough, right? So if we find both are present, like I find some features are of the benign mass and some features are of the malignant mass, then it becomes inconclusive and you might have to advise for further evaluations. And in some cases, none of them were present, it was very haphazard mass, then also it is inconclusive and we give for further evaluation. So now let us just let us just put it with examples. For example, if I see these kind of masses, now this one I know very simply, I don't need to put Iota criteria here. I know this is a benign mass, it is well defined, anechoic, cystic, unilocular, and all, no papillary excrescences, no solid component, no vascularity, so all the features of benign. So we know, and by our experience also, I don't need to apply even this, by my experience also I know that this is a simple ovarian cyst. Then this one, so what is this? This is a very typical picture for hemorrhagic cyst. So I don't need to apply the criteria here, but still if I say it is a multiloculated mass, it has well defined margins, smooth margins, and then it is definitely looking less than 10 centimeter. Hemorrhagic cysts are usually less than 5-6 centimeters and it is within the ovary. So I can be pretty sure that this is benign, and by my experience I know this is a typical appearance of hemorrhagic cyst. Then this one, what is it typically? Again, it is a smooth uniloculated mass, well defined cystic area, and you can make out there are smooth, low level, low grade echos, very typical of endometrioma. If you will put color, you will see color probably just at the periphery. And then this one, high vascularity, solid area, very irregular area. Definitely we know that this is malignant and we don't need to apply all those criteria. We are sure that this is malignant only, and what it is likely this was a Krukenberg's tumor. Fine. But sometimes you may come across masses which may show you mixed features of benign and malignant. Like see this one, it is irregular, it is solid, it is predominantly solid. It has cystic areas, obviously. It is predominantly solid. It is quite big. In fact, there was more of it which I have not been able to put up in the picture, in one still picture. So this was big and this was avascular. So we have features which are favoring malignant. It is irregular, it is solid, predominantly it is big one, and it is the only benign feature I had was avascular. But when this was analyzed, this turned out to be a dermoid, right? So these are the areas where you have to be careful. Then this one, it was big, around 13-14 centimeter. This is the same mass. It was predominantly solid with few cystic areas. It was irregular. It had acoustic shadow. Can you see? There are areas of small calcifications also. It had acoustic shadow and it was vascular. So yes, there was one benign feature only, that was acoustic shadow, but rest were all malignant, and this turned out to be a malignant mass. It was diagnosed as cystadenocarcinoma. Then this is the third one. It was again very irregular, haphazard, having solid as well as cystic areas. There was no vascularity and it was very big, right? So we do have mixed features. No, what are the features of malignancy here? Irregular, big, solid components are there. Only feature was there was no vascularity, and after the operation, this turned out to be, on histopathology, this turned out to be a cystadenoma, right? So sometimes they can fool you. And the last one, it was small, so one feature benign. It had acoustic shadow, so one feature again benign. It had papillary excrescences more than 4, and it had high vascularity. So this turned out to be malignant again. Fine. So this is just to tell you that the criteria has to be applied when you are looking at masses which are a little confusing. No? And now all these masses, if supposing I would have just relied on this bright area or echo, which bright area which is giving acoustic shadow, then I could have thought that this is a benign one, this is likely a dermoid. But since it did not look like very typical like a dermoid, so obviously I would put these criteria into use and I can make out that whether this is benign or malignant. This, what is the most important point that comes out here? It is that you would be able to know that these are the masses which require further evaluation. And one thing you must have noticed in all the pictures which I showed you now, right now here, most of them, what was the clinching point? The vascularity. So Doppler becomes very important when you are looking at the ovarian masses. And remember one thing, whenever you are looking at the gynecological masses, always keep this in mind that the velocity range or the PRF should be low. No, keep the velocity range of PRF in the range of 5 to 6 centimeters per second. Don't keep it very high, not more than 8, 9 at least. No, keep it in the lower range. If required, you may even use power Doppler to see vascularity. So keep this part in mind and it will make it easy for you to diagnose the confusing ovarian masses. And then there is this risk calculator that has been developed, and this is the calculator. It is still in the experimental form, but yes, you can still use it. That how much is there a risk of malignancy? Now in this case they have put up the benign features and they have put up the malignant features in form of a table. Choose the mass and see what are the features that you could see. For example, I saw there was an acoustic shadow present, and then I find there is an irregular solid tumor present. So if I calculate it by this SR calculator, you will find it on the net. If you will search for simple rules risk calculator or SR risk calculator, you will find it on the net. Then press calculate and you will get that there is estimated likelihood of benign is this much and of malignancy is this much. So there is an estimated risk of 61.7% that this is likely a malignant tumor. Right? What two features we have just chosen? One is that there was a caustic shadow present, but the second was it was an irregular solid tumor. So if I would have just relied on my typical distinct appearance, I could have thought that there is a caustic shadow, this is likely dermoid only, but in some cases it may turn out to be a different thing altogether. So you have to be cautious and always put color in ovarian masses. It will give you a very good clue. No, mostly like the benign masses, they will not show you color. Dermoids are also avascular. The hemorrhagic cells, endometriotic cells, follicular cells, all just show you flow at the periphery. So be very cautious when you are diagnosing, and this can help you in cases where you are confused. So this is all for today, and this is what is IOTA criteria. If you wish, you can apply it and you can use it in your regular practice. So I hope this would be useful for you. Thank you.